Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. So today we entered mock test 10, NEETPG mock test 10. I hope every mock test is giving you enough challenge like the actual exam with image-based questions, clinical vignette-based questions, very high yield topics which are frequently tested in the actual NEETPG exam. I'm sure that your preparation is really heating up in solving these 50 full-scale NEETPG mock tests. Please visit learnograph.com. Every mock test, all these 50 mock tests are provided as PDFs. And each PDF has 200 mind maps of explanatory answers. So take the test like a very serious exam going student with an alarm. Whether you get 50 marks, 100 correct, 20 correct, doesn't matter. You solve all the 200 and then go through all the explanatory answers and then join the discussion. Bacho, Anita, Rani, Rajesh, Ravinder, and many more who are all online. So please punch the voice loud and clear for all of you, doctor. Yes. Now, once you download the NEETPG mock test from the learnograph.com, you have the schedule, as you can see. After that, you have the question paper. This question paper, I send you in the WhatsApp group before only. Try to solve it. Just to download, share it with your friends, and then solve it before you come to the test. All right? And once you finish the test, just wait for the ebook to be published onto the learnograph.com, and you have all the 200 questions and explanations of these questions. So let's make the great beginning, doctor. 35-year-old. Thank you, Kuldeep, for the feedback that voice is loud and clear. 35-year-old complaining central dark spot, fundus, photography, and the OCT has been shown, right? So central serous retinopathy. So what you have here is a central serous retinopathy where there is an accumulation of the fluid under the neurosensory retina, as you can see here, right? And optical coherence tomography. This is called optical coherence tomography will provide the imaging that confirms the accumulation of the fluid beneath the retina is what beneath the retinal pigment epithelium defines the central serous retinopathy. So I leave the literature for you. What is the etiology, clinical features, and how do you evaluate? Now, a 56-year-old from the Mumbai presents for eye examination. So what can you see here, doctor? Hollenhorst plug. What is this called? Hollenhorst plug. They're the cholesterol emboli that are observed in the retinal arteries, and the main cause is the cholesterol crystals from the atherosclerotic plaques which travel through the smaller arteries is what you need to appreciate. A patient presents with a sudden painless vision loss in one eye, no signs of pain or discomfort. So what do you see on the imaging, doctor? This is called cherry red spot. What is this called? Cherry red spot, which is typically seen in case of the central retinal artery occlusion. is what you need to remember. Once more, the etiology of the cravo. What are the clinical features? Very important. Sudden, painless, unilateral vision loss. जो होता है, that is the classical clinical feature of cravo. Now, a patient presents with a sudden onset of painless blurred vision in one eye. Blurred vision in one eye. So what you are able to see here, doctor, typically extensive intraretinal hemorrhages, typically affecting all the four quadrants, is very classical of central retinal vein occlusion, which presents with sudden painless blurred vision along with optic disc edema. Extensive intraretinal hemorrhages in all the quadrants is what you need to remember. So cravo, CR, vivo is a favorite question of the examiner doctor. You need to be very sure. 35-year-old with SLE receiving treatment with hydroxychloroquine, HCQ, right? During the COVID time, a lot of you came to know about this drug called HCQS, hydroxychloroquine sulfate. Typically in SLE, to treat the arthritis, we give hydroxychloroquine sulfate. But long-term giving that will lead to bull's eye maculopathy is what you're able to see, which is caused by hydroxychloroquine retinal toxicity is what you need to remember. Very good to see 9 online classmates. Excellent, doctor. At least by 10th full-scale mock test discussion, we have 9 regular attending live students. I'm so happy. At least by 50th full-scale grand test live discussion before June 23rd, 2024, we will have 50 to 60 live in the classroom is my hope. So inform all your friends. You can share the PDF free to any number of people that you meet up, no worries. So you have a joint discussion with your friends. Tell them that it is almost free on the YouTube. Only they need to pay 500 rupees per ebook to download from the learnograph.com, which contain 200 explanations is what you need to know. So one thing you should know, doctor, paying to a coaching program, paying to an app, buying a notes and that arriving in the courier, we think that is all enough and we feel mentally secure. Not enough. We need to consume it, doctor. We need to consume it. If you take day-long coaching programs, they will exhaust you. You have no time. You get fatigued. And it looks like a torture in a concentration camp. You're all adults. You don't need all that. Write notes, taking mock tests regularly with 2 to 3 friends together, and going through all the 200 questions, explanations in the ebook and joining the discussion. That's all. You do that 50 full-scale grand tests, solve 10,000 MCQs, and almost there are 30 to 40 image-based questions. So almost there are 2,000 image-based questions. Tomorrow's NEETPG, nothing else will come. It will come from Dr. Murli Bharadwaj, 50 full-scale NEETPG mock test, 100% strike rate is what I am promising. In the past 25 years, I have the privilege of giving coaching to 3 lakh medical students. Many of them are toppers. Almost 2 generations of students are toppers in the past 25 years. I wish you will also become one such, dreaming for the dream seat in the top 1,000 ranks. All right. So just study along with me. My promise is I will take you to become the topper. So 34-year-old with the new onset seizures and cognitive changes and MRI has been shown. So the MRI is showing enhancing periventricular lesion with a moderate edema, which is very typical of the primary CNS lymphoma, especially. And why not glioblastoma multiforme? Glioblastoma multiforme will form a ring-enhancing lesion with a central necrosis is the characteristic of glioblastoma multiforme. All right, doc? So you should know everything about the primary CNS lymphoma. So you need to do a biopsy, histological examination to confirm the diagnosis of primary CNS lymphoma. A 46-year-old lorry driver with painful blisters on the penis is what you're able to see. The blisters are preceded by a tingling sensation in the affected area. What is your diagnosis? It is genital herpes, typically caused by herpes simplex virus 2 is what you need to basically remember. Right, doctor? Very good to see 12 online classmates. Please stay back until the end of the discussion. You will definitely learn a lot of things and get better for the tomorrow's NEETPG exam. 28-year-old from Goa with a painless ulcer on the coronal sulcus of the penis with the swollen inguinal lymph nodes. So what is your diagnosis, doctor? So typically it is a painless ulcer on the penis with inguinal lymphadenopathy characteristic of primary syphilis is what you need to remember. So once more, I leave to you the literature. Every mind map has all the high-yield facts about that particular topic. In one mind map, you get everything that you need to revise. So 200 mind maps may you get almost 1500 to 2000 high-yield points. Imagine by the time you finish solving 10,000 questions and 50 full-scale mock tests, you are the king. But you need to practice it before coming for the discussion. Right, doctor? Now, 38-year-old patient presents with fever, heart murmur. Blood cultures are positive for the Streptococcus viridans. So what are you seeing here, doctor? All those vasculitic lesions, which is characteristic of infective endocrinitis with secondary valvulitis is what you need to basically remember. So rot spots, everything you should know in infective endocrinitis. 40-year-old with shortness of breath and palpitations, a chest X-ray has been shown to you, right? And there is an enlarged cardiac silhouette with the dilatation of the ascending aorta. Ascending aorta is dilated, doctor, dilated. Typical of aortic regurgitation with a left ventricular enlargement is what you need to remember. So all the valvular heart diseases, shadow within the shadow appearance. Where do you see? Whenever the left atrium is enlarged in mitral regurgitation, you get shadow within the shadow appearance, where the left atrium will enlarge towards the right side and the right heart border, you find two shadows when the left atrium enlarges, which is called shadow within the shadow appearance, which you see in case of the left atrial enlargement in mitral regurgitation. Now, a 32-year-old fatigue, shortness of breath. So this is what you call shadow within the shadow appearance, which is typically seen, and there is a splaying of the carina. The trachea is there, no tracheal bifurcation got wide angled. So the splaying of the carina, that all is suggestive of a postural mediastinal structure. So which is most posterior among the chambers of the heart, left atrium. So esophagus, trachea, they're all in the postural part. So there is a splaying of the carina of the trachea. Whenever the left atrium enlarges, where does left atrium enlarge? It enlarges in mitral regurgitation, mitral valve disease, wherever the left atrium is enlarged. So I leave the literature for you to quickly do the revision. 34-year-old, shortness of breath, palpitations, high-pitched blowing murmur. What kind of murmur is this? It is an early diastolic murmur. So, a early diastolic murmur, which is high-pitched blowing, heard best along the left sternal border. characteristic of aortic regurgitation is what you need to remember. So I leave the literature for you. What are the clinical features? What are the diagnostic tools? What is the kind of murmur? Everything about the aortic regurgitation you should be very sure. A 54-year-old female undergoes an ECG. In the ECG, what do you find? Typically, there is a wide QRS complexes. Normally, in the lead one, there will be a Q wave. Before the R, there is a Q wave. So, the lack of Q wave in the lead one, M-shaped marrow, M-A-R-R-O-W, and the other one, you have the M-shaped change, which is seen on the William. This looks like a W, and this looks like a M. So W-I-L-L-A-M, M is V6. M-shaped change in V6 in QRS. And W-shaped in lead 1. That is left bundle branch block is what you need to remember. So I leave the literature for you to do the revision. Now, a 46-year-old CEO from Bengaluru undergoes myocardial perfusion scan. Myocardial perfusion scan. So, is there any paid group for all the detailed discussions, right? Yes, very much is there. The moment, is there any group for all the detailed discussions by sir? Yes, yes. So once you enroll for our 50 full-scale mock test series, doctor, you get instead of 500 rupees for each, you can pay 10,000 rupees and get all the 50 full-scale mock tests, and you will become the part of the Super 30 group where we have many more discussions keep happening in addition to this. So take every opportunity today. So you can 9000868 You can WhatsApp and you get all the details for joining the Super 30 batch. Now, 46-year-old CEO from Bengaluru undergoes a myocardial perfusion scan. Now, what does this basically suggest? So, there is a normal uptake of the tracer at the rest and reduced uptake during the stress, particularly in the anterior wall, which typically suggests reversible anterior wall myocardial ischemia in the stress test perfusion is what you have to basically remember. A 54-year-old with sudden visual impairment with severe headache, fundoscopy has been shown to you. Fundoscopy has been shown to you. So swollen optic disc, retinal hemorrhages, cotton wool spots, they're all indicative of grade 4 hypertensive retinopathy is what you should remember. Now, a 36-year-old with fatigue, palpitations, difficulty breathing when lying flat. An echo, color Doppler, cardiac catheterization, echo, color Doppler, cardiac catheterization have been shown to you. So, what are the mostly diagnoses? So, you should remember, echocardiography is showing a restricted mitral valve movement, right? And there is a turbulent flow across the mitral valve on colored Doppler, which is very much suggestive of mitral stenosis is what you need to remember. Similarly, when you do the cardiac catheterization, you can calculate the pressure gradient And this kind of a pattern of diastolic gradient across the valve is highly suggestive of mitral stenosis is what you need to remember. So tomorrow's NEETPG, they'll give straight ditto, same question. You should be ready to interpret the pressure volume curve of MS, MR, AS, AR. You need to be very, very sure about. Right, doctor? Now, a 36-year-old patient with a history of recurrent respiratory infection and fatigue, transesophageal echocardiogram is being shown to you, right? So, the presence of an opening between the left and right atria is visualized in the transesophageal echo here, which is very classical of atrial septal defect is what you need to remember. A 42-year-old from Chennai presents with chest pain and dyspnea following a severe emotional event. Maybe the girlfriend dumped him, right? Or a wife dumped him and left with the children, making him all alone. So the left ventriculography is being shown. So this is during diastole, this is during systole. So this is called cardiomyopathy. That is chest pain and dyspnea coupled with a apical ballooning of the left ventricle. Apical ballooning of the left ventricle. So Takotsubo is a Japanese term, right? And typically it is a cardiomyopathy precipitated by stress. And apical ballooning is very, very characteristic feature. And to manage the cardiac stress and reduce the myocardial workload, beta blockers and ACE inhibitors can very much be given. Diuretics can be used if there are any signs of heart failure. And emotional and physical stress reduction is very, very important. Typically, the prognosis is very good with recovery of ventricular function within days to weeks. It's more common in the postmenopausal women actually, is what you need to remember. A newborn infant is born to the mother who has a poorly controlled diabetes. Diabetes में क्या होता है बच्चों? Caudal regression syndrome is a very classical appearance of caudal regression syndrome in diabetic pregnancy. 21-year-old medical student doing internship has a widespread itchy rash that started as red spots and progressed to blisters. Some of them beginning to crust. It is day 6 of the illness. What is your diagnosis? This is a classical varicella. Chicken pox is what you need to remember. So varicella spreads by droplets and red spots, blisters, scabs. By day 6, most of the lesions get crusted. And it is primarily clinical based upon the nature of the rash. You can make the diagnosis. A 38-year-old female with a thick white vaginal discharge. So what is this, doctor? Thick white cottage cheese-like discharge. And what do you see here? Branching hyphae is very characteristic of Candida albicans infection. Whenever you do a gram staining of the vaginal smear, branching hyphae are characteristic of gram of Candida infection. 34-year-old multiparous woman presents with the mucopurulent discharge. Mucopurulent discharge. Intermittent cervical bleeding. Examination of the cervix is being shown to you. Right? So this is an example of cervicitis. Mucopurulent discharge, cervical erythema, and ectropion along with the patient's symptoms of intermittent cervical bleeding strongly suggest cervicitis. And you should always consider chlamydia, gonorrhea to be responsible is what you should remember. Now, doctor, pelvic inflammatory disease, let me tell you, is one of the favorite topics of the examiner. Cervicitis, PID, Fitz-Hugh-Curtis syndrome of gonococcus, and the various organisms, gonococcal, chlamydial, how do you differentiate, trichomonas, vaginalis, etc., etc. Everything, you should iron out the subject, doctor. Now, 32-year-old with chronic pelvic pain with dysmenorrhea, pain during intercourse. Dyspareunia, pain during intercourse. And what do you see? Burnt powdered appearance, which is typically the feature of endometriosis. Powder burn, laparoscopic finding on the uterosacral ligaments is highly typical of endometriosis, is what you need to remember. Now, doctor, a 16-year-old from Kota, Rajasthan, preparing for her NEET UG exam, presents with irregular menstrual periods and hirsutism, and ultrasound is being shown to you, which is classical of polycystic ovarian disease. What is this called? String of pearls appearance on the ultrasound is what you need to remember. A 32-year-old female with vaginal bleeding and uterus larger than expected for gestational age. Beta HCG levels are elevated. And what do you see here, doctor? Typically, there are cluster of grapes appearance. What is this called? Cluster of grapes appearance. Hydropic swollen cystic villi with excessive beta HCG is classical of partial hydatiform mole, is what you need to remember. Partial hydatiform mole. So partial moles occur when two sperms fertilize a single egg, leading to an embryo with an extra set of chromosomes, which is called triploidy. And this genetic imbalance leads to abnormal placental tissue characterized by swollen cystic villi. And how do you know it is partial mole? Vaginal bleeding in the first trimester, larger than expected size of the uterus for the given gestational age, no fetal heartbeat, hyperemesis gravidarum, cluster of grapes appearance, elevated serum beta HCG is what you need to remember. Now, doctor, a 48-year-old with resistant hypertension, episodes of muscle weakness and CT scan typically is showing a mass, suprarenal mass, adrenal mass. So, hypertension, hypokalemia, and what do you see? Canary yellow adrenal mass, yellow adrenal adenoma, yellow colored canary yellow adrenal adenoma, which is typically called Conn syndrome, which is aldosterone producing adenoma, is what you need to remember. So, a 42-year-old with episodic headache, sweating and palpitations and CT scan is showing pheochromocytoma, which is classical. 68-year-old from Pune with proteinuria with progressive decline in renal function. So, this is Kimmelston-Wilson's nodules, which are typical of diabetic nephropathy. Kimmelston-Wilson's nodules. Patient has got the clinical features which are being shown to you. There is a gingival bleeding, perifollicular hemorrhages are seen, which is very classical of vitamin C deficiency associated scurvy. Patient has a sudden onset of severe epigastric pain, vomiting, sensation of the food being stuck after swallowing. And this is the typical appearance, which you can see, where organoaxial, mesenterico-axial rotation of a gastric valvulus, where the barium outlines the stomach, showing the portion of the small arrows indicating the volvulus. So this is a classical gastric volvulus, is what you should remember. A patient with a family history of neuropathy, family history, difficulty seeing in the night, elevated levels of the phytanic acid. So the combination of pescavus, which you are able to see here, elevated phytanic acid, night blindness, Progressive peripheral neuropathy is called Refsum's disease, where phytanic acid get accumulated, right? Shortcut Marie-Tooth syndrome is very close differential, but it does not involve night blindness or phytanic acid accumulation. Friedreich's ataxia can have pes cavus, but there are cardiac issues, ataxia without any specific biochemical changes. So that is how you differentiate and approach pes cavus. A patient presents with severe itching, violaceous, flat-topped skin lesions and abnormal nail changes, which are shown in the figure. So this is called lichen planus. Itchy, purplish, polygonal, specific nail changes such as longitudinal ridging, it is called as, and cuticular overgrowth, which is called pterygium, are classical and characteristic of lichen planus is what you need to remember. A patient with violet colored erythema on the eyelids, heliotrope rash it is called. Gottron's papules is what you are able to see, which is classical of dermatomyositis is what you need to remember. A patient presents with a chronic cough, history of recurrent chest infections. Imaging shows bronchiectasis. And what is this called? Yellow nail syndrome, which is very classical of the bronchiectasis patients is what you should remember. And there is a lymphedema, bronchiectasis, yellow nail syndrome, which is very characteristic feature. The patient has chronic lesions on the neck accompanied by the history of inflamed red patches as what you can see here. Right, doctor? Red patches that healed with discoloration. Classical of discoid lupus erythematosus is what you need to remember. A patient presents with a well-defined pigmented lesion, pigmented skin lesion, which has got a stuck-on appearance, just like you took a little dung and stuck onto the face, onto the wall. The lesion is asymptomatic, but has increased size over last year. So what is the diagnosis? Seborrheic keratosis, a common benign skin growth. Typically, if it suddenly appears in multiple numbers, then it is a sign of internal malignancy. Wonderful, doctor. I am very proud and happy to see 13 online classmates. Please don't forget. A teacher, a humble teacher like me is always happy to have a sumptuous number of students. We all sit together like classmates, benchmates, roommates, table mates, solve a 200 MCQ paper, full-scale NEETPG mock test. Every NEETPG, there are at least 35, 40, 45 image-based MCQs. Even in our mock test also, we will give just like the actual NEETPG exam feeling you will get. Clinical Binet-based questions. On the classical topics, we also did an analysis retrospectively of around 10,000 MCQs in the past 10 years of NEETPG. Then we found there is a pattern by which examiner is asking the questions. We used a Python language, machine learning, in order to analyze retrospectively the question bank, what is hot, steaming for the examiner, and compose these questions accordingly. So it is a kind of reverse engineering, paper out. Only thing is 50 full-scale grand test, 10,000 questions, each as a ebook of PDF. Make it a point to solve the 200 questions every day, do the preparation, revise the high-yield facts in the 200 mind maps that I'll be giving to you, and you're ready for the exam to fight with the examiner for any kind of question, doctor. So please do come. Please tell your friends. All these discussions on the YouTube are absolutely free. Only we want you to pay when you download the ebook PDF $500 and then download a mock test, solve it, and join the discussion. So, doctor, that is the story of the seborrheic keratosis. Patient presents with a painful vesicular rash with a dermatomal distribution of the C2. It is herpes zoster is what you should remember. A patient presents with a red, itchy, circular rash with a clear center. Clear center is classical of tinea rubrum, which is the ringworm infection. Once more, what is the etiology? Trichophyton rubrum. Clinical features, diagnostic tools. What are the treatment options? Clotrimazole, miconazole, terbinafine, applied on the affected area. Antifungal medication is the treatment. So that completes our image-based questions. Now, doctor, 27-year-old male with no medical history, hemoptysis, hematuria. So, Alport syndrome and good posture, both of them involve type 4 collagen is what you need to remember. So, Alport is a hereditary condition. 30-year-old man, once more doctor, everything about Alport. Type 4 collagen infected. There is a glomerulonephritis, hearing loss, ocular abnormalities, etc., etc. in Alport. You need to be very sure about. 30-year-old with icteric sclerae, giddiness, tea-colored, urine, cystocytes. What is the meaning of cystocyte? There's a hemolysis. So, there are no cystocytes. That means it is not microangiopathic hemolysis. So, this is a classical story of G6PD deficiency is what you should remember. Young boy with hearing loss, coarse facial features, hepatosplenomegaly. Classical of Hunter's disease, iduronate sulfatase deficiency, which is X-linked recessive. Middle-aged man with a history of asthma, hyperinflation, flattened diaphragm. So progressive dyspnea with hyperinflated links, emphysema. So alpha-1 antitrypsin deficiency. 3-year-old boy, abdominal pain, vomiting, constipation, regression in speech. Think about lead poisoning. So what is Poisson distribution? Poisson distribution is a modeling the number of times an event occurs in an interval of time or space when events occur independently is Poisson distribution. So we also did a Poisson distribution analysis of what are those high-yield topics, what are those high-yield facts which are frequently tested by the examiner. Now, doctor, physical quality of life index is the most comprehensive information about the improvement in the local population's health status. PQLI is the best. Whenever there is shedding the infectious agent during the period of recovery, it is called convalescent carrier. So once more, I leave the literature for you, doctor, who is incubatory, convalescent, healthy, pseudo, paradoxical, and for everything, an example for everything. So in one mind map में पूरा खत्म खुल्लम खुला रिविजन हो जाएगा, ठीक है? 30-year-old healthcare worker, induration of 10 mm is generally considered positive for tuberculosis. So remember, doctor, if you solve the paper and come for the discussion, it looks very normal speed. But if you have just landed in the discussion, it looks very fast. But I need to be fast because I need to finish 100 questions in 1 hour. Because beyond 1 hour, it is impossible to sit before computer or a YouTube to revise. BOD level above 300 is indicative of strong sewage, suggesting a high level of organic pollution. Less than 300, weak sewage. More than 300, strong sewage. बच्चों, कार्डियोलॉजिस्ट बनना है तो सुवेज के बारे में पहला पढ़ाई करो, मजे में पढ़ो, रोते हुए नहीं पढ़ना, अगर रोए तो डिप्रेशन में जाए तो भूल जाओगे, भूलना अच्छा नहीं है, डिप्रेशन को बोलते हैं सूडो डिमेंशिया. Don't get into that, no need for that. I will tell you what to read, what to remember, and what to reproduce in the tomorrow's exam. The spleen rate is a classical measure to assess the endemicity of malaria in the community, doctor. Very nice to see 13 online classmates. Please tell every day Dr. Murali Bharadwaj comes online, right? Don't miss me because I don't want to miss you, and we will all study together. Please go to learnograph.com, download the full-scale grand test, and also solve the questions and come to the discussion. So IDCF focuses on the childhood diarrheas with ORS and zinc as the key treatment. So what is meant by intensified diarrhea control fortnight? Reduce the death of dehydration due to diarrhea. It is held annually in the month of June when the diarrhea occurs, right? I'm born in June 6th. I bring rains. I brought rains in June. So June is the time of intense diarrhea once the rains begin. So promote ORS and zinc for the childhood diarrhea treatment. Now, doctor, a vitamin A prophylaxis is the specific health program aimed to prevent vitamin A deficiency. So you should know Ministry of Health and Family Welfare, what are the programs under it? Vitamin A prophylaxis, nutritional anemia prophylaxis, iron deficiency, food safety and standard authority of India. Women and child development under the human resource development के नीचे ICDS. Social welfare के नीचे department के नीचे the special nutrition program and Balwadi nutrition program. Education Ministry के अंदर midday meal program is what you need to remember. Now, a hospital administrator is revising the waste disposal protocols. Dispose the syringes with the fixed needles in white bins. If you look at the NEETPG exam, past 10 years, हर एक entrance में एक question आएगा, black sheep, have you any wool? Yes sir, yes sir. Yellow color, red color, blue color, white color. Each color में क्या लगाओगे? This color coding of the biomedical waste is the favorite topic, doctor. If you didn't read and go to the exam, you missed the opportunity to become a topper. Now, district mental health program is aimed at decentralizing the mental health care. It has been tested as a pilot project in Ballari in Karnataka. So you need to be very, very sure about. Now, doctor, a 30-year-old female with 6-month history, itchy, scaly plaques on the elbows and knees, classical of psoriasis. You need to smell the diagnosis. So, skin-colored umbilicated lesions, molluscum contagiosum, pruritic papules and burrows in the interdigital space, scabies. Silver-colored erythematous scaly plaques on the extensor surface of the knees and elbows and on the scalp, hands and trunk, typical of psoriasis. Pink, purple plaques and papules with severe pruritus on the volar surface of the wrist but not on the dorsum of the hand and not on the scalp is lichen. So you have to be very sure, doctor. These are all the favorite questions of the examiner. Very good, very good. 13 online classmates, stay online. We'll finish at least 100 questions before we go to sleep. Hypertension with hypokalemia and metabolic alkalosis. Whenever the aldosterone is high, it will lead to retention of the sodium, loss of potassium and H plus ion. Loss of H plus ion into urine will lead to metabolic alkalosis. Loss of K plus ion into the urine will lead to hypokalemia. Retention of the sodium will lead to hypertension. The combination is what you need to remember. Similarly, when the primary hyperaldosteronism is there, Aldosterone is produced by the adrenal adenoma. It does not need any renin to stimulate aldosterone production. Hence, plasma renin activity is undetectable. You can't find it. With an elevated aldosterone, the combination undetectable plasma renin activity with elevated aldosterone suggests that, oh, this aldosterone is produced by adrenal adenoma, which is primary hyperaldosteronism. 25-year-old woman comes to clinic, 2-week history of fever, generalized maculopapular rash. She is taking an antibiotic. There is eosinophilia. Urine analysis show WBC cause, elevated serum creatinine, all suggest drug-induced interstitial nephritis is what you need to remember. So typically penicillins, cephalosporins, classical of drug-induced interstitial nephritis. So if you give steroids, you can speed up the recovery, but could even worse, but it will worsen the infections. Right, doctor? Now, let's go to the next question. 60-year-old male with a recent knee surgery, developed DVT, give IV unfractionated heparin is considered to be the immediate anticoagulation for DVT. So, a uric nucleic acid amplification test suggests Neisseria gonorrhea. So, what should be included in her screening? Always syphilis, according to the STI guidelines. Syphilis need to be included in the screening. So, now doctor, 32-year-old, painful erythematous nodules on the shins, characteristic of erythema nodosum. What is erythema nodosum? It is the paniculitis. Inflammation of the fat tissue is called erythema nodosum. More commonly affects women, occur on the shins. Tender indurated lesions appear on the lower extremities is what you should remember. A 58-year-old long-standing type 1 diabetes. He has been on multi-dose insulin regimen, started avoiding social activities. So there is a fear of recurrent hypoglycemia in him. So emergency glucagon kits can provide safety against such kind of episodes. So whenever any patient is having a long-standing type 1 diabetes, pancreaticogenic diabetes, in them there is a hypoglycemia in insulin therapy, is what you need to remember. Now doctor, 38-year-old with HIV, CD4 count only 80, and chest X-ray showed diffuse interstitial infiltrates, pancytopenia, that is bone marrow suppression, which are very classical of progressive disseminated histoplasmosis is what you need to remember. So this 25-year-old with abdominal bloating after consuming dairy products is having lactose intolerance. How do you detect lactose intolerance, doctor? It is hydrogen breath test with which you will detect. So whenever UTI is there, monthly catheter changes can help minimize the catheter-associated UTI, who cannot, typically is what you need to remember. Now, 34-year-old presents with 2-month history of dry cough, bilateral hilar lymphadenopathy without respiratory distress is very typical of sarcoidosis. So whenever you are giving cytotoxic chemotherapy, why there will be development of alopecia? Because it targets the anagen phase where follicle cells are rapidly dividing is what you need to remember. So hair loss during chemotherapy is typically due to anagen effluvium is what you need to remember. So anagen phase, catagen phase, telogen phase, everything you should have to be very sure about, doctor. Now, 33-year-old, HIV CD4 count is 50 only, progressive disseminated histoplasmosis. So how do you treat? After initial amphotericin B therapy, itraconazole is the drug which is used to for maintenance is what you need to remember. Right, doctor? Now, 55-year-old with ascending muscle weakness, history of hypertension, treated with hydrochlorothiazide, ECG show U waves. U waves signify hypokalemia, especially when she is using hydrochlorothiazide, which can lead to caliuresis is what you need to remember. 70-year-old with syncopal episode after standing too quickly. So drop in BP upon standing and giddiness is called orthostatic hypotension. Now, 45-year-old dilated esophagus with a bird beak appearance at the gastroesophageal junction is what you will find. Why? Because if you look at the history, dysphagia to both the solids and liquids with regurgitation and weight loss, they're all suggestive of achalasia cardia is what you need to remember. Every NEETPG exam without achalasia cardia, bird beak appearance, there is no question paper. If you do manometry, there is an increased lower esophageal sphincter resting pressure, incomplete lower esophageal sphincter relaxation with a decreased peristalsis of the distal esophagus with the bird beak narrowing is very, very classical. 30-year-old taking valproate, having elevated serum amylase. Wow, I'm so proud and happy to see 16 online classmates. Very good. Tell all your friends in the world. They might have subscribed to apps, gone to face-to-face coaching programs, might have gone to Batti Maro, Ratta Maro, Jaldi Maro, any kind of program they might have attended. They might have ordered for bundles and bundles of courier of notes. ये सब करने के बाद भी पढ़ने के लिए मोटिवेशन आना, अगर पढ़ने का अगर आप देखें तो hardly there are only 1,000 topics that you need to master, from which 200 questions come. Open secret, any coaching guru will tell the same. For example, leukemia, lymphoma, carcinoma endometrium, carcinoma cervix, ovarian carcinoma, bone tumors, acid-base disturbances, Bartter syndrome, Liddle syndrome, Gitelman syndrome, pheochromocytoma, like that. You can count on your fingers. 1,000 topics. If you don't have 1,000 topic, high-yield topic, sure short topic list based upon the last 10 years of the 10,000 questions analysis, once upon a time, there used to be 2012, 2013, there are 1,400, 1,500 questions released in the NEETPG. Later it became 300 marks, later it became 200 marks paper, right? So totally 10,500 questions are there. After analysis, only 1,000 topics you need to master, out of which 200 questions are going to come, and 50 full-scale grant tests. I give you 50 full-scale mock tests. Each mock test has got mind maps, 200 mind maps of explanations. Each mock test has clinical minute-based questions, image-based questions, just like the actual NEETPG exam. So already we finished with 10 full-scale grant tests. This is the 10th full-scale grant test we are discussing. Totally 50 full-scale grant tests end hone tak before June 23rd. I will give you 10,000 questions, 10,000 mind maps, in which 50,000 high yield facts. Each mind map में आपको मिल जाएगा पूरा revision summary. आप फिर notes को जाने का जरूरत नहीं है. All right, just practice it. Join the discussion. You will become the winner. Go to learnograph.com. Each mock test PDF you download. Solve the 200 questions with a timer, and then come to the discussion, doctor. Every day, whenever possible, every day or every alternate day, I finish the 50 full-scale mock test for you, right? So, very happy to see 15 online classmates. Keep in touch, be part of our WhatsApp study group, Super 30 group. And if you want how to join Super 30 group, please request 900868 to be the part of it. So, doctor, valproate is one of the causes for the drug-induced. So, diuretics, IBD medications, immunosuppressants, HIV medications, antibiotics, they all can lead to drug-induced pancreatitis. 40-year-old woman, 3-month history of persistent dry cough. She works as a firefighter, bilateral hilar lymphadenopathy, hypercalcemia, which is classical. So the hilar lymph nodes in sarcoidosis will be so big, they're called potato nodes, is what you need to remember. So sarcoidosis is associated with hypercalcemia. 24-year-old urinary tract infection, typically urine pH is 8.5, and there are stromatous stones which are typically caused by the urease producing organisms like Proteus mirabilis, is what you need to remember. 72-year-old male with history of hypertension, atrial fibrillation, asymmetric neurological findings, and stepwise cognitive decline. Stepwise cognitive decline, characteristic of vascular dementia. Also, hypertension, atrial fibrillation, they all increase the chance of vascular dementia. Why not? This is Alzheimer's disease. In Alzheimer's, typically you have early personality changes, hallucinations. They are the features of Alzheimer's and Lewy body dementia. Why not frontotemporal dementia? It's called FTD. FTD में very early personality changes आएगा, right? So that is not the feature of FTD. So I leave the literature for you in one shot, doctor. Vascular dementia is the topic of interest. This mind map will give you everything. So today only download the PDF of the mock test from learnograph.com. 78-year-old with 4-year history of Parkinsonism. Memory impairment occurred after the onset of the motor symptoms. So first motor symptoms like rigidity, akinesia, tremor, then memory impairment. Classical of Parkinson's disease associated dementia, right? Now, why not Lewy body? In case of Lewy body dementia, there will be REM sleep behavior disorder, marked hallucinations. They are very classical. Similarly, why not supranuclear palsy? There the vertical ocular movements get affected, right? Preserved ocular movements is against the diagnosis. Why not Alzheimer's? Alzheimer's typically presents with memory impairment before motor symptoms, whereas Parkinson's disease associated dementia में पहला motor symptoms बाद में dementia is what you need to remember. Now, doctor, 72-year-old with 6-month history of progressive difficulty in walking, broad-based guide, frequent falling. So guide disturbance, urinary urgency, cognitive impairment, the triad of clinical features. Guide disturbance, difficulty in walking. My dad is having difficulty in walking. The son will tell. Daughter-in-law will say, no, he's also having a problem with holding his bladder. Then the old man's wife will say, he's even forgetting that I am his wife. So the combination, guide disturbance, urinary urgency, cognitive impairment, the combination in an elderly person is normal pressure hydrocephalus is what you need to remember. A 6-year-old girl, 3-month history of drooping eyelid on the right side, lack of sweating on the same side. So ptosis, meiosis, and anhidrosis indicate Horner. And there is an interruption of sympathetic nerves. Only 6-year-old girl. That is classical of neuroblastoma is what you need to remember. Whatever, we are becoming very popular, 17 online classmates. So please inform your friends also that कहीं भी कोचिंग लेना मगर मुरली भारद्वाज के साथ 50 फुल स्केल ग्रैंड टेस्ट का प्रैक्टिस करो बिफोर जून 23, 2024 जरूर सीट आएगा. 200 out of 200 questions come from our 15 full-scale mock tests and the mind maps, which give all the high-yield facts. Every day I come online on the YouTube and conduct this free session. But before coming, please solve the question paper. I'll post it in the WhatsApp study group and also upload the mind maps ebook on the learnograph.com. So, doctor, 30-year-old, progressive weakness and Shawn-like sensory loss. It's also called dissociate sensory loss, which is classical of syringomyelia, because the decusating fibers get affected by the syrinx. Posterior columns, which are carrying touch sensation, are not affected. So touch and vibration preserved, but loss of pain and temperature in the Shawn-like distribution, classical of syringomyelia, is what you need to remember. 22-year-old brought to the emergency, 1 day history of fever, headache and confusion, and temporal lobe edema on MRI with fever, seizures and confusion, classical of herpes simplex encephalitis. That's the reason you need to start, especially in the elderly patient. Acyclovir, intravenous acyclovir is what you need to remember. 25-year-old woman is evaluated. Sudden episode of shaking witnessed by the friend. And the lateral tongue biting is there, which is very classical of generalized epileptic seizure. Epileptic seizure. 52-year-old with involuntary eye closure that worsens in bright light, which is very classical of blepharospasm. Blepharospasm. So, what are the differential diagnoses? What are the associations, etc.? You need to be very sure, doctor. So, I leave the literature for you. Now, let's go to the next question. A 17-year-old girl, she has no complaints and her medical history is unremarkable. She is not sexually active. So HPV vaccine is recommended to adolescents to prevent the future infection. How many doses, doctor? 3 doses. 3 doses are indicated for individuals aged more than 15 years is what you need to remember. There is a history of progressive gait instability and the family history of similar symptoms. So, what is an important complication you want to monitor in a patient of Friedreich's ataxia? Diabetes mellitus develops in the patients of Friedreich's ataxia. You need to be very, very sure about. Now, a newborn is found to have a portion of the intestine protruding through a defect on the right side of the umbilical cord. There is no covering sac. The infant is otherwise healthy and no facial abnormalities or the limb defects. What is your diagnosis? Gastroscus. Characteristic bubble herniation without a covering sac indicate gastroscus. Typically it is right of the umbilical cord. Defect is right of the umbilical cord. So you need to know, if it is Beckwith-Widman syndrome, there will be features of omphalocele, a midline defect with a protective sac, along with macroglossia. Ear creases is very, very characteristic feature, is what you need to understand. Now, doctor, a newborn with a birth weight of 4.5 kg, typically limp hand, ipsilateral harness syndrome, indicating C8T1 injury, is indicative of Klumpke's paralysis, is what you need to remember. 4-year-old child, post-auricular tenderness, erythema, auricle displacement, that is all characteristic of mastoiditis, is what you need to understand. Acute mastoiditis. Paroxysmal cough, post-tussive emesis, suggestive of purchases. Triple bubble sign, history of maternal cocaine, which is vasoconstrictive, suggests jejunal atresia. Absent TREC. What is meant by TREC, doctor? T-cell receptor excision circles. In the newborn screening, is characteristic of severe combined immunodeficiency, where there's a lymphopenia, hypogammaglobulinemia, and what is the treatment of SCID? Stem cell transplant is the only curative treatment which need to be performed. Similarly, Bruton's gamma-globulinemia. What are the differential diagnoses? You need to be very sure. Every NEETPG exam, this is one of the favorite questions, doctor. आप तो एकदम गर्मा-गर्म पढ़ना. Bruton's gamma-globulinemia, absent B cells, low serum immunoglobulins, normal T cell concentration. How about chronic granulomatous disease? NADH oxidase defect, recurrent skin and soft tissue infection. Common variable immunodeficiency. You have hypogammaglobulinemia with recurrent sinopulmonary infections. Wischott outrage, thrombocytopenia with eczema and bleeding and T cell dysfunction is Wischott outrage. So I leave all the high yield facts in one mind map, which will give you a comprehensive review, doctor. Just go to the learnograph.com and download all the 50 full-scale grant tests. I'll be sequentially releasing every day and alternate day, and we'll be discussing, solve all these 50 full-scale grant tests and 10,000 mind maps that provide you the necessary revision material for the NEETPG exam. Now, doctor, 9-year-old with 2-week history of tender swollen lymph node. So skin lesion, lymphadenopathy after cat scratch. Is cat scratch disease, initiate treatment with azithromycin is the treatment of choice. Azithromycin is the treatment of choice is what you need to remember. Now, 2-year-old Treacher-Collins syndrome require anesthesia. So high risk of tongue falling back is there. Oropharyngeal airway is designed to keep the tongue from blocking the posterior pharynx is what you should remember. So difficult airway management in congenital syndromes. What are all the congenital syndromes? Trisomy 21, difficult for an anesthetist. Why? Large tongue, small mouth. Goldenhar syndrome. It's called ocular auriculovertebral anomaly. Congenital syndrome, Klippel-Feil. Fused cervical vertebrae with a rigid neck. Pyri-Robin, large tongue with a small mouth. Treacher-Collins, mandibular dysostosis. Turner syndrome, short stature. So these are all the congenital syndromes that provide a challenge for an anesthetist to do the intubation. Clinician is monitoring under general anesthesia, did capnography. So a slanted upstroke between expiratory upstroke and plateau phase indicates an obstructive pattern. Increased alpha angle suggests a airflow obstruction, which is typical of bronchospasm. So, doctor, please review this important mind map I have given to you. Capnograph measures CO2 in the expired air. It has 4 phases. Phase 1, inspiratory baseline. Phase 2 is expiratory upstroke. Phase 3 is plateau phase. Phase 4 is terminal upstroke before phase 0. Phase 4 can occur in pregnancy. Phase 3, CO2 from alveoli, the end tidal CO2 measurement point. Phase 2 is expiratory upstroke, rapid increase from respiratory dead space to alveolar gas. Phase 1 is inspiratory baseline, no CO2 present and marks the beginning of expiration. इसमें 2 एंगल्स मालूम होना है आपको कैप्नोग्राफी में. एक होता है अल्फा एंगल बिटवीन फेज 2 एंड फेज 3 विद अ शार्प अपस्ट्रोक. दूसरा होता है बीटा एंगल बिटवीन फेज 3 एंड डिसेंडिंग लिम्ब. It is normally sharp is what you need to remember. Now, doctor, what drugs you need to discontinue before the day of surgery and after the day, which you can continue. I'll leave the literature for you. Oral hypoglycemics, Viagra, warfarin, potassium sparing diuretics, lithium, stop before 24 hours, vitamins, minerals, iron, herbal supplements, topical creams. What you can continue? What can you continue? Preoperative medications, antidepressants, antihypertensives, asthma medications, beta blockers, dioxin, COX-2 inhibitors, eye drops, diuretics, except for thiazides, statins, thyroid medications, steroids, anti-epileptics, if no risk of renal failure, insulin with dose modification. Now, 30-year-old requires surgery for carpal tunnel. Whenever you are giving intravenous regional anesthesia, it is also called Bayer's block. Whenever you are doing anesthesia for arm or leg procedures below the elbow or knee, you do the Bayer's block. So, preservative-free prilocaine is the one which is preferred for the IVRA to minimize the risk of adverse reactions. Now, desflurane is the drug noted for global warming potential among the volatile anesthetics. So you should know all the properties of desflurane. Less potent than isoflurane, most pungent, not preferred for induction, no nephrotoxicity, desflurane, no fluoride ions are produced, hence desflurane, no nephrotoxicity. Highest global warming, xenon is least, is what you need to remember. But overall, if you take worldwide, it is the nitrous oxide commonly used and it is contributing most to the increased climate impact globally, is what you should remember. A 60-year-old, typically painful rash on the right side of the forehead that stops abruptly at the midline means herpes zoster ophthalmicus. And vesicular rash in the ophthalmic division of the trigeminal nerve by the herpes zoster chickenpox reactivation is called Hutchinson's sign, where the lesion is on the tip of the nose, is what you need to remember. 35-year-old, typically slowly enlarging violet nodule on the dorsal side of his hand. On exposure to fish tank is very classical of atypical mycobacterial infection due to Mycobacterium marinum, is what you need to remember. So where do you find downgrading reaction in leprosy? It can occur in untreated patients and more common during the third trimester of pregnancy. So you need to be very sure, leprosy management, reactions in leprosy, etc., etc. Now, a 4-year-old girl, white forelock, heterochromia, iridis, congenital deafness, they are all characteristic of Waardenburg syndrome. So, pybaldism, Waardenburg syndrome, Shaw-Waardenburg, vitiligo and poliosis, chemical leukoderma, you should know all these pigmentation disorders by heart. 28-year-old women, 39 weeks in gestation, in labor, at 8 centimeters cervical dilatation for the past 5 hours. Contractions are noted to be strong, occurring every 3 minutes. Fetal heart rate is reassuring. So, whenever there is no change in dilatation, cervical dilatation for more than 4 hours, in spite of adequate contractions, that is the diagnosis of active phase arrest. Caesarean delivery is recommended to prevent the fetal and maternal morbidity associated with the prolonged labor. So you should know, doctor, protraction, cervical change slower than expected. Inadequate contractions treated with oxytocin. Arrest means no cervical change for more than 4 hours with adequate contraction leads to caesarean delivery, or more than 6 hours with inadequate contractions. If you look at labor phases, latent phase is up to 6 centimeters, 6 to 10 is active phase. Active phase management, labor management is expected dilatation rate is more than 1 centimeter every 2 hours. And caesarean delivery is the treatment for active phase arrest, is what you need to remember. So all these things you need to remember, doctor. And all the remaining 200 questions, I leave the literature for you. Everything has got a mind map, the correct answer, explanatory answer, and important points to remember in every mind map. And I'm quite sure you will get courage, energy, time, patience to revise all the 200 mind maps of the 200 explanatory answers But don't forget, before you come to the discussion itself, right, doc? Before you come to the discussion itself, I give you this PDF in the WhatsApp study group, right? One day before. So you try to solve the PDF, the question paper, right? You try to solve the question paper, keeping an alarm, whatever be your answer. You share the PDF with 3 to 4 friends also, I have no problem. One of you pay $500 and then share to 2, 3 friends, no problem. But go to the learnograph.com and there you can be able to download the ebook, right? By paying $500 and then get all the needed essence. So here you have the schedule of the mock test, doctor. Now we are with the mock test number 10. All right. So good luck for your exam and good dream. Dream and hope is the greatest invention unique for the human beings. Animals cannot bring that incurable hope and optimism. Only humans have a power to imagine good things that are going to happen to us when we crack the top 1,000 ranks. So that is most important thing, doctor, the power of imagination, the power of hope and dream. And I'm sitting here not to teach you, but to inspire you to solve 200 questions every day by Dr. Murli Bharadwaj's 50 full-scale mock tests. Good night and enjoy the preparation for NEETPG.